January is Cervical Cancer Awareness Month. I know I'm late, but anyway, let us today discuss about cervical cancer. But before that, subscribe to get videos on medical insights, motivation, inspiration, and basically about life. Cervical cancer comes from the growth of cells in the cervix, which is the lower part of the uterus that links to the vagina. Most cases of cervical cancer are linked to different strains of the human papillomavirus, which is a common infection transmitted through sexual contact. While the body's immune system usually fights HPV, in a small percentage of individuals, the virus survives for years, contributing to the transformation of certain cervical cells into cancerous ones. To minimize the risk of cervical cancer, you need to undergo screening tests and get vaccinated against HPV infection. In cases where cervical cancer happens, the first treatment typically involves surgical removal of the cancer. Additional treatment options may involve medications to kill the cancer cells, such as chemotherapy and targeted therapy. Radiation therapy utilizing high-energy beams may also be used, sometimes in combination with low-dose chemotherapy. Initially, cervical cancer may not show any symptoms, but as it progresses, signs may include vaginal bleeding after intercourse, between periods, or after menopause. We have menstrual bleeding that is heavier and more prolonged than normal, watery, bloody vaginal discharge with a potentially strong odor, pelvic pain or discomfort, especially during intercourse. The start of cervical cancer happens when the DNA of healthy cells in the cervix undergoes changes. The DNA provides instructions to cells in their functioning, and these changes lead to rapid multiplication of cells. Unlike healthy cells that undergo natural cycles of life and death, the changed cells continue living, leading to an excess of cells that may form a mass known as a tumor. These cells can invade and harm healthy tissues, eventually breaking away and spreading to other parts of the body. The primary cause of the majority of cervical cancer is the human papillomavirus, which is a common virus transmitted through sexual contact. For many people, they experience no issues as the virus goes away on its own. But for some may undergo cell changes caused by the virus that can potentially progress to cancer. Cervical cancer is categorized into types based on the type of cell it began from. Let us look at the main types. Number one, we have squamous cell carcinoma, which begins from a thin, flat squamous cells that line the outer part of the cervix. The majority of cervical cancer fall into this category. Number two, we have adenocarcinoma, which begins in the column-shaped gland cells lining the cervical canal. Sometimes cervical cancer involves both cell types, while extremely rare cases may involve other cells in the cervix. Risk factors for cervical cancer may include smoking tobacco. Smoking raises the risk of cervical cancer, as HPV infection in smokers tend to last longer. Number two, we have number of sexual partners. A higher number of sexual partners for both yourself and your partner increases the likelihood of contracting HPV, which is the main cause to cervical cancer. Then we have three is early sexual activity. Engaging in sexual activity at a young age raises the risk of HPV infection. Then we have other sexual transmitted infections, which are STIs. Presence of other STIs such as herpes, chlamydia, gonorrhea, syphilis, and HIV and AIDS increases the risk of HPV, which can lead to cervical cancer. Another thing is weakened immune system. People with a compromised immune system due to other health conditions are more likely to develop cervical cancer if they get infected with HPV. Then the last thing is exposure to miscarriage prevention medicine. If a parent used a medicine called diethylstilbestrol, also known as DES, during pregnancy, which is a medicine from the 1950s to prevent miscarriage, there might be an increased risk of cervical cancer. This medicine was linked to clear cell adenocarcinoma. To minimize your risk of cervical cancer, you need 1. HPV vaccine. Ask your doctor about the HPV vaccine, which can lower the risk of HPV infection and reduce the likelihood of cervical cancer and other related cancers. Number 2, we have regular pap test. You need to undergo routine pap test for early detection of precancerous cervical conditions. Monitoring or treating these conditions can prevent the development of cervical cancer. Many medical organizations suggest to start regular pap tests around the age of 21 and repeat them at recommended intervals. Number 3, we have safe sex practices. Practice safe sex to lower the risk of cervical cancer. This involves consistent condom use and limiting the number of sexual partners. Then you have 4, quit smoking. If you smoke, seek help from a healthcare professional to quit, and non-smokers should avoid starting as smoking increases the risk of cervical cancer. Thank you for watching this video. I am going to make another video talking about diagnosis, treatment, and screening of cervical cancer. If you like this video, like, share, and subscribe to get more medical and health insights. See you next time.